Hello, welcome back to Inspire Ed, where we learn, apply, and achieve success. And today we are going to be tackling AP Psychology, Module 68 of the Myers textbook. And we are talking about the different psychological disorders. And today we're going to be talking about schizophrenia. So, schizophrenia is a type of psychotic disorder, which is a group of disorders marked by irrational ideas, distorted perceptions, and a loss of contact with reality. Schizophrenia itself is a disorder characterized by delusions, which is a split from reality and having false beliefs, hallucinations, which is false sensory experiences. For example, seeing things when in reality there's nothing there. And also disorganized speech and diminished or inappropriate emotional expression. So it is mostly a split from reality. So there are many types of symptoms of schizophrenia, and one of the main symptoms are disturbed perceptions and beliefs. So specifically, as we mentioned, hallucination, which is false perceptions of false sensory experiences, such as seeing something when in actuality there actually isn't anything there. And there's also delusion, which is false beliefs, often of persecution or grandeur. So maybe someone believing that they're going to be attacked or etc. And another major symptom is called catatonia, which is abnormal movement behaviors presented by the patient. So for example, they might do very weird moves like crawling around a classroom, which are not usually normal behavior. And of course, disorganized speech, which is usually called a word salad. So it is basically a jumbled ideas spilled out in illogical order. So for example, a patient said that she was surrounded by movie stars, and then she suddenly pointed to the color of the wall and asked if the room was painted blue to get her upset. So as you can see, the patient's ideas are jumbled up, and when they express their feelings and thoughts, it's jumbled up in illogical order, so it doesn't make sense. And it is important to note that all of these symptoms are positive symptoms because these are added behaviors once you get schizophrenia. On the other hand, there's negative symptoms such as inappropriate or emotionless expression, or difficulty perceiving facial expression, and struggling to feel empathy and compassion for others. So an example of inappropriate emotions might be laughing when someone is talking about their grandmother's death. So these are all negative examples, negative symptoms. Let's move on to the onset and development of schizophrenia. So there are two types of schizophrenia. One is chronic schizophrenia, which is a slow developing process. It is a form of schizophrenia in which symptoms appear by late adolescence or early adulthood. So usually around 17 years old. And usually chronic schizophrenia is when the psychotic episodes last much longer and the recovery period is much shorter. And they also exhibit more negative symptoms such as emotionless expression, lack of empathy, etc. On the other hand, acute schizophrenia is a form of schizophrenia that can begin at any age, and it is usually a response to a traumatic event. So, unlike chronic schizophrenia, it occurs at any age and is usually a response to a traumatic event. And fortunately, for acute schizophrenia, recovery is much more likely, and there are more positive symptoms that respond to drug therapy. So it is more curable through drugs. And again, note that positive symptoms does not mean that it is semantically more positive, but in the sense that it's just added behaviors and not diminished behaviors. And again, added behaviors would be having hallucination or delusion when you have schizophrenia, which you would not have if you did not have this psychotic disorder. And negative symptoms would be the lack of emotion and having the lack of empathy for others. These are all negative behaviors, so diminished behaviors from your normal state. So let's understand schizophrenia. So again, we are looking at this through a biopsychosocial approach. So in terms of biology, there are definitely brain abnormalities that cause schizophrenia. One of the biggest factors is dopamine overactivity. So when a patient has excess number of dopamine receptors in their brain, this intensifies the brain signals and creates more positive symptoms such as hallucinations and also delusions and paranoia. And in terms of the brain anatomy, there's abnormally low brain activity in the frontal lobe. So this diminishes the logical thinking in the person and thus makes them more irrational and again paranoid. So again, we have to remember that the frontal lobe is the part of the brain that makes judgments, and so when there's diminished activity in the brain in the frontal lobe, this means that they have lack of judgment. And there's also a decline in brain waves that reflect synced neural firing in frontal lobes. So, PET scans show that there's overactivity in the thalamus and amygdala. And again, we must remember that amygdala is the part of the brain that processes fear. And again, when there's overactivity in the amygdala, this causes paranoia. Another brain abnormality would be enlarged fluid-filled ventricles and shrinkage and thinning of cerebral tissue. And again, looking from the biological perspective, this type of psychotic disorder is very easily to be inherited through relatives and family, especially if you are an identical twin, and if your twin also has this psychotic disorder, you have a very high chance. And there is also a smaller than normal cortex, hippocampus and corpus callosum. These are all, and again, corpus callosum is the part of the brain that connects the two brain hemispheres together. And there is also a smaller thalamus. So again, the thalamus is in charge of filtering incoming sensory signals and transmitting it to the brain's cortex. So when there's a smaller thalamus, then there is a difficulty in filtering sensory input and causes inattention. In terms of prenatal environment and risk, is what we call epigenetics, in which changes in the environment can cause DNA or gene change. So it is not necessarily a biological factor, but an epigenetic factor. So these factors include an older paternal age, or a mom that has diabetes, or when the mom was pregnant, they caught a viral infection or the flu. And also if they were living in poor famine conditions, and also if the baby was born at a very low weight, or they were oxygen deprived at birth. In terms of genetic factors, again, I mentioned that if you have family or siblings or parents with disorder, there is a 1 in 10 odd. But if you are identical twins, then it is a 1 in 2 odds, so 50% chance that you will get schizophrenia if your twin has schizophrenia. And again, there are many factors to this. It is because they share the same prenatal environment, and the blood, the placenta, and the blood that it supplies. And adopted children who have biological parents that are schizophrenic will also have the risk of getting it no matter the environment. So as long as the gene exists, there is a great chance of getting schizophrenia. And again, gene influences dopamine and other neurotransmitters in brain, and it is also in charge of the production of myelin. In terms of environmental factors, there are many factors such as birth complications, as I mentioned, such as low birth weight and oxygen deprivation at birth. And also if the person was separated from parents at an early age during childhood. And if they have a short attention span as well. And also if they have poor muscle coordination, or they have disruptive or withdrawn behavior since young. And this could also, again, be caused by traumatic events such as childhood physical, sexual, or emotional abuse, which could trigger schizophrenia. And again, it is important to note the diaphysis stress model, which is a model that explains that mental disorders develop when an individual has a vulnerability, or innate vulnerability where they are genetically predisposed. For example, their parent or their sibling has schizophrenia. And when you already have these genetic predisposition combined with a traumatic or stressful life event, will greatly increase your risk of getting the mental disorder. So you can see here, the resilient individual stays here, but the vulnerable individual, after experiencing a negative environment and a negative outcome, would be at the very bottom, and then slowly rise their way up to the resilient individual. And here are 2 FRQ questions for you to practice. Thank you so much for watching this video. I hope this helped, and good luck studying for the AP exams. Stay tuned for the next video. Bye!